Haya, Nine Wajak, Yuid, Nunga, Maman. Nine Mut, Kul. Wajak, Yuid, Wagokep. Nunga Buja. Nija, Kulin, Buja, Nunuk, Nini. Hello, I'm a Noongar man. My family of ancestors walked through Noongar land. I'd like to acknowledge that we're meeting on the Kulin country and wish to pay my respects to the elders, past and present. I'm a Noongar man from Perth, Western Australia. My father being Turkish, my mum a part of the stolen generation, grew up in Ninorshire Mission in Western Australia. I grew up Turkish after my parents were divorced when I was 8. I denied my Aboriginality until I was reunited with my mother at the age of 16. I grew up in country Victoria and such held the typical negative lies that existed surrounding the Indigenous community. My views changed over the next 3 years where I had the opportunity to learn about my culture and heritage. I had the opportunity to go bush with my Uncle Don, where I still have fond memories of sitting around the campfire, yarning, hunting, fishing. Being a Noongar man from an urban area, I never given to any thought to how people lived in remote areas. I took the electricity, the availability of good food, running water, access to everyday and emergency services for granted. And just in case you're wondering, I'm the good looking one. Me and my brother. This all changed at the age of 19 when, as a first aid instructor, I had my first opportunity to visit a remote community up north of Western Australia. I was shocked by the conditions in which this community lived. As you can see, no roads, no footpaths. In terms of electricity, they had one single generator that powered the whole community. They had one block of ice that they'd use to actually cool their food. No parks, no playgrounds. It was the first time I saw Australians denied of the most basic opportunities. So in terms, suddenly the social determinants of health became very real to me. I spent some time in that community, watching, learning, listening. I soon came to realise that in terms of this once proud traditional community, with over 40,000 years of healthy living, had become eroded by changes in diet, physical inactivity, smoking, and a lack of opportunity. They now face enormous disease challenges, unfortunately. Narrative repeated across Indigenous communities around Australia. And it's just bigger than being a community being unhealthy. It's a loss of language, loss of culture, loss of land. I became very angry, and still am. Angry, frustrated about witnessing what's happened. So in terms of that, I used it as my source of inspiration. So I use it as a source of passion to be able to find solutions, utilising exercise as medicine. I was frustrated by the millions of dollars being poured into the cure, in terms of a drop being poured into the prevention of disease. While exercise as medicine research has been conducted in a non-Indigenous community, there's been no meaningful research being conducted in the Indigenous community. So culturally safe spaces for Indigenous communities to train are too far and too few in between. So my PhD focused on the creation of culturally safe exercise venues. So I met with local councils, I met with the gym owners, and in terms, got a small group of Indigenous people together into the gym. As they became more confident, they strengthened relationships with other gym goers, hence creating a new community. We gave them this simple but powerful tool to create opportunities to take back their health in that culturally safe environment. So what did I learn? Well, first of all, that the focus on improving quality of life in Indigenous communities by reducing those risk factors and associated burden of disease. For Indigenous community, the biggest health gains can be gained by tackling the risk factors. But more importantly, we must stop telling the Indigenous community to be healthy, but not providing the same opportunities to lead a healthy life that is afforded to most Australians. Access to food, access to primary health care, access to quality education, and of course, culturally appropriate spaces for Indigenous people to exercise in. Secondly, we must move from the biomedical model of health, where health is the absence of disease. Instead, revolve around the holistic model of health, incorporating all the factors that impact on Indigenous community. Physical activity and exercise must be a standard part of exercise prevention and treatment, and must be incorporated into the medical paradigm in Australia. Creating safe places to exercise must be a priority response to NCDs. It's not about telling or blaming, it's about empowering the Indigenous community. The reorientation of this health sector is an important one. So what is my call of you? Basically, jump on board and help create the roadmap to success. As a group, as a nation, let's decide that whether we live in the city or the country, whether we're Indigenous or not, that every Australian deserves the access to the same opportunities to avoid the debilitating chronic disease. We can do it, and it's the right thing to do. We need to do it. Let's also realise that just like other cultural groups, providing Indigenous Australians a culturally safe place to exercise, integrated with medical services, nutrition, will make a real difference in people suffering from high levels of NCDs. So in the 21st century, let's share a vision. And most importantly, turn that vision into reality. That every child in our country, no matter where they live, be given a safe place to play and have a great start in life. Most of you will agree that health is a right at this age, and exercise is medicine. So let's create an environment that allows every Australian equal access to the benefits of an active life. In achieving this, we'll go a long way to eliminating the burden of the disease and finally ensure a good quality life for all Australians. 9 Kut Jurapin Wanging Nunukut Nunukut Nini Kaya. My heart is happy to be speaking with you and sharing knowledge while you sat and listened. Thank you and goodbye.